Hi, welcome to the American Roundtable. I'm Al Spry.
And I'm Bill Strickland.
We have a great show for you today. Here on Tough TV, we're talking about politics as unusual like we like to do. It's the Straight Talk Zone. And we're talking about the race for president. On the Republican side, a shocking development in Colorado as the people are denied the vote and all the delegates go to Ted Cruz. We'll talk about that. We'll also talk to Candace Crawford. She's with the Mental Health Association of Central Florida. And we will be talking with her about mental health issues. But what's most important is we have to make sure that the vote is counted, right, Will?
Hey, you can see why Trump has an issue with what's going on.
He's very angry, as am I, for a matter of fact, because we can't take shortcuts in this process. This process means too much. It means too much for America and Americans. This and a whole lot more on American Roundtable on Tough TV. Stay tuned.
The control is in the hands of a few. It doesn't matter if you're a voter and you voted, is what does the establishment want? And if they don't want you, then it's going to be lights out. Now, Trump has said all along he wants something fair. He doesn't want to get screwed over. And I can see him getting upset about this because he's got a legitimate complaint about it. He could win everything, and then something will happen in the convention, and he's out.
Well, they can change the rules at the convention and just deny him the nomination. Of course, that will create a firestorm. I'm sure there'll be protests. It's not something they probably want to do. But I believe the establishment is deathly afraid of Donald Trump.
Why is that?
Deathly afraid of him.
What do you think?
I think because he doesn't play their game. I think he's doing a different game, and they don't know what his intentions are. And they are deathly afraid of this guy. I don't think he can be controlled like all the other politicians they have under their thumb. So we will have to see what happens. We'll be talking with Candy Crawford about mental health in just a moment. It's the American Roundtable on Tough TV. Welcome back to the American Roundtable. So happy to have our guest today, and this is Candace Crawford with the Mental Health Association of Central Florida. Candy, it's great to have you here on American Roundtable.
Thank you.
I'd like to kick things off with a troubling statistic, of course. We are the third largest state in Florida, and that's where this show originates. However, mental health spending in Florida is actually last in the nation. Why is that? To me, this is quite challenging and unexpected when I read it.
Yes, well, it's actually a couple of reasons. One is the political power behind trying to push for mental health is not the same political power that tries to push for corporate incentives in our state or any kind of growth in our state, although the contribution from good mental health contributes substantially to our economy. Because just in the year of 2014, there was about several $billion of lack of productivity because of mental health illnesses. And these are people that work, but they're not at work because they have an illness. So we have many stats to substantiate why it's a good investment for our state. So in the latter part of the 2006, 2007, 2008, when our recession hit, the funding from Washington was reduced significantly to all the states. So many of the states recognized that in 2012 and 2013. And so they made it a priority. 36 states in the U.S. made it a priority to increase the funding because they were so far behind. Texas and California leading the way, and then other states followed. Florida did not. Florida actually reduced their mental health funding. So when Texas passed their budget in 2014, they did a one-time immediate general revenue increase of $253 million of new money that they put into mental health. The same thing happened in the state of California to a much larger number because they do have a much bigger, they did already have a big number for mental health. Florida did not. So we are the last in the nation. We spend, as of last year's budget, we spent $37 per person in Florida. Mississippi spends $143 per person. So you can see that we don't even come close to comparing to anybody on what we're doing to try to fund services for mental health, which leaves us really in a huge situation of just not having services for a lot of people.
Well, my follow-up to that would be, why not? Why are we so lax in mental health spending? What is the governor aware of this issue? Is the legislature in Florida aware of this issue? Where's the disconnect happening?
Well, it's a lack of concern. It has absolutely nothing to do with them being aware or unaware. They are very aware of the situation of funding. We have not let them rest. We have literally taken on a campaign that we started last November called Elect Health. And what we did was we engaged social media and letter writing and email writing to the governor and the leadership in the House and the Senate. And we had thousands of communications that went to them. And we contacted over 700,000 people around the state to make the outreach. And they have first started this session at a recommendation from the governor for $19 million in new spending. The session ended with an additional $53 million in additional spending. However, Florida Tax Watch, when they researched it, they found that Florida would need to, if they infused an additional $130 million, it would only bring us back up to 2001 funding levels.
Well, I'd like to talk more about this with you, and of course some other issues relating to mental health. So happy to have Candace Crawford here with the Mental Health Association of Central Florida. We're talking about mental health on today's American Roundtable, and we have a lot more in store for you. Just stay tuned. Welcome back to American Roundtable. We're here with Candy Crawford, Mental Health Association of Central Florida. I'd like to continue on the previous line, Candy.
Okay.
Why do you think there is such a disconnect? I guess you called it earlier a lack of concern. Why do you think there's a lack of concern?
Well, the big push in the legislature doesn't center around the poor, the needy, the helpless. That they have a track record of the last 4 to 6 years of totally ignoring those type of needs. Florida has refused to take the Medicare funding from the federal government, which leaves about 350,000 mental health patients without Medicaid, and they can't afford to buy insurance. So they've refused to take that, although it's completely funded by the federal government. So that leaves a big gap there. We have 16,000 veterans that are without services. We have so many numbers of people. We have 1 million people that need health care that have no access
Well,
to
I
it.
have to ask you this, of course, as a follow-up. I mean, mental health to me is not a conservative or liberal or issue. To me, it's an issue that spans across socioeconomic demographics. So I understand now the present government in Florida is very conservative. However, don't conservative people have mental health issues as well?
Absolutely.
And also richer people as well as poor people? So why do you see that there's still that neglect there?
Because the people that have insurance and the people that can afford to get their health care and their mental health services are the people that are making the decision on where to put the money and funding in Florida. Mm-hmm. And it's to their advantage to fund corporations. It's their advantage to support big business, because when they have to run for re-election, they don't get their money from people in the mental health field. They get their money from the big companies. So they're investing to their best interests. They're not really looking out for poor people in Florida. Fortunately, this year, the free clinics did get a $10 million allocation because we have to have free clinics in Florida to take up for the gap that we have because of the lack of Medicaid funding. Mm-hmm. So the governor vetoed it the year before. So we work very closely with Shepherd's Hope, which is a free health clinic. We take their patients, they take our patients, because very few people have just one health issue. Usually you have a comorbid condition, and so you have to have health care along with your mental health services. Can't just treat part of the body.
Sure, that's understandable. How do you see mental health trends in a national scale here in the U.S.? What do you see things getting better, staying the same, getting worse? What are you seeing right now?
It's not a huge improvement. There was just recently a couple of $2 billion allocation from Washington, but that's all over the country. And so what we have to really tune into is the state of Florida. The state of Florida owes it to their citizens to make sure they have access to health care. And I like to use the term health care as much as I use mental health because of the fact that it is part of health care. But you can't bifurcate these issues. Mental health is part of your health care.
Well, that's good. That's a good point. Do you see that there has been a bifurcation, and if so, why?
Oh, yes, and they fund it separately. They have silo funding. They fund health care in a totally different line and separate for mental health. They do now are funding, co-mixing funding for some substance abuse and mental health because that goes hand in hand. But as far as the health for people, medical services for people, it's a different silo. And we've got to get away from that because that, again, kind of reinforces the stigma of mental health services.
Yeah, I concur with that. I think that it's important to understand that mental health is part of the bigger health picture, and if we don't treat mental health, we're going to see continued headlines in the paper about this violence and shootings and suicides, and none of this is very encouraging.
Well, I'm glad you brought that up because there is the fact that we have mental health brought into these mass shootings. It's horrible that these patients that obviously have some very serious mental health issues are committing these horrendous headline shootings. It's just horrible. But less than 5% of the violent crimes in the United States are committed by people with mental health issues.
We'll talk more about that. This is the American Roundtable. I'm Al Spry, and we'll have more with Candy Crawford. Welcome back to the American Roundtable. So happy to have my guest, Candace Crawford, Mental Health Association of Central Florida. Candy, welcome back to the show.
Thank you.
Of course, this is one of a two-part interview that we're doing with you over the next couple of weeks, and we'd like to find out more about what you do and what you do with mental health. Why don't you, along the lines of what we discussed further, of course, it is a very low number of mental health patients who are violent, but you have to include it in the gross, right? I mean, mental health can manifest in those ways. And in order to stop this, I think that the focus has to be on mental health.
Correct. That's the problem, is that what you have is when someone's illness crashes and you really have a serious situation and they have no access to services, you put them in, they get Baker Act, they're in the hospital, they're in and out, they're not getting long-term care.
What's a Baker Act for folks that don't know?
The Baker Act is the Florida statute that allows someone to be involuntarily hospitalized for 3 days based on the fact that they're either dangerous to others or to themselves. So patients go in, and during that 3-day, they are evaluated, and then a judge makes the decision of whether they are able to leave or they should stay for continued services. But that is not a long-term care correction. That's not something that can really help someone. It gets them started in the process, but we have so few beds available for people without insurance and resources that they usually just end up back out trying to make it on their own. And the only difference between that homeless person on the street with mental illness is you and me. You and I would take care of our family. We're there for them. We understand it. We try to be understanding. There's a lot of people that they don't understand it. They don't understand the illness, and it's very difficult to live with. But we do take care of our family members. I have a sister that I take care of that make sure my brother and I make sure that she's taken care of. Mm-hmm. And that's what happens. You have family members that have the wherewithal to do it, and they make it happen. But the person on the street has fallen out of the family, or there is no family. So without these services and it being readily available, people just don't know where to go. Mm-hmm.
Yeah, I'd love to talk with you more about this, of course. We'll do it in the next episode of American Roundtable. Until then, Candace Crawford, thank you very much for coming on the show.
Thank you.
I'm Al Spry. A few final words in just a moment. Welcome back to the American Roundtable. I'm Al Spry.
And I'm Bill Strickler.
It's great to have Candy on, Candy Crawford from the Mental Health Association of Florida. I noticed, though, even though she's in Central Florida, a lot of these issues are being seen and felt across the country, which is why we wanted to bring it to you.
Well, people have problems, especially when the economy's bad. It kind of irritates. If somebody's got depression, they become more depressed. They can't pay their bills. They start falling off the cliff. And if somebody has a problem, it's going to elevate it and put things out of control. And
Well, mental health touched your life
Yeah. So, it's still touching my life.
with people that you know, family members
Right,
and so forth, right?
Yeah. So, when Florida is the 51st state or territory in spending,
Bottom, dead last.
and that's an issue.
Especially when we're the third largest state in America. We should have the third largest funding for mental health.
Right, and up north, a lot of mental hospitals just got people out on the street, and a lot of the people that are homeless have mental issues. So it's not real good for Florida, and as progressive as we pretend or say we are, and want people to move to Florida, we're not taking care of people that we have here.
I think that there's more than enough money in the Florida budget to prioritize mental health, because mental health is a cornerstone of the functioning of a society. If you don't have a good mental health program, you run into everything like a domino effect. It affects everything. Because what are companies made out of? They're made out of people. What is the government made out of? It's made out of people. If you don't treat these mental health issues, if you don't say, we have to fund this, we have to help people. This is the same as healthcare, like Candace said. This is no different than healthcare. We have to stop bifurcating, splitting, in other words, mental health from health, because they're all related. And the functioning of a society and the proper functioning of a society is not related to gun control. It's not related to anything else except mental health.
Well, you take a look at some of the TV shows on now. We accept there's a TV show, My Crazy Ex-Girlfriend. So what does that really tell you? Well, okay, so maybe some girls have a problem. So now we're making jokes about it.
Well, I think that's abhorrent. I haven't heard about this show, but I could tell you one thing, I wouldn't be watching it.
It was a show or a movie?
Final thoughts. Paul Ryan says, count me out. The quote is, I do not want, nor will I accept the Republican nomination. So we could count Paul Ryan out of the fray. But we'll keep up to date, and we'll keep you up to date on this and many other issues on the American Roundtable on Tough TV.